Hi, everybody, and welcome to our panel discussion at the Obesity Forum. This is called Navigating the Obesity Journey, highlighting the patient perspective. And today we have three wonderful panelists who will share their personal experiences with obesity. Our goal is to better understand obesity as a chronic disease, to recognize the importance of weight stigma, and to explore how we can incorporate patient preferences and shared decision-making in obesity care. My name is Scott Kahan. I'm the director of the National Center for Weight and Wellness and a faculty member at the George Washington University School of Medicine. I'm primarily an obesity medicine specialist working with patients day in, day out to help them navigate obesity and all the things that go along with it, not just the clinical science stuff and the treatment stuff, but also the interpersonal things like the stigma and such that we'll hear about today. And so let me introduce you to our three fantastic panelists, Faith, Nikki, and Vu. And I'd love for you each to share a bit of your journey with obesity, a little bit about yourselves, and in particular, some key moments, whether positive or negative, that occurred along your journey managing obesity over time. So Faith, would you like to start?
Sure. So I have lived with my obesity my entire life. My mom knew from a very young age that it was going to be something that I struggled with, and it's something that my entire family has struggled with as well. So I think of my journey as before having access to care and after having access to care. So, as I mentioned, my mom knew from the time that I was very small that my weight was going to be something that I struggled with. So, during early appointments, she attempted to approach my providers to ask them for some advice. My mom was very dedicated to motherhood. She was always looking things up, trying to do things by the book. And so she went where she thought she could receive assistance, and that was from my providers. Unfortunately, prior to meeting the wonderful team that I met in my teenage years, my mom received a lot of stigmatizing advice, and she remembers very clearly one provider telling her specifically not to feed me cookies for dinner. That was the extent of the advice that she got. So, a lot of our efforts when I was younger were self directed. And I think that there was a lot of harm that came from that self directed attempts at weight management, but that's all that we really had access to without being able to talk to providers who were knowledgeable on obesity. When I was 15, I had the opportunity to attend a clinic at Duke. I was really blessed and didn't realize how lucky I was to live near a clinic that offered a wide variety of treatment options for pediatric obesity. And I ultimately made the decision to undergo metabolic and bariatric surgery when I was 16. Both of my parents had the procedure at different times in my childhood, so I had a really good idea of what it looked like and knew that I would probably go down that route. And so having access to care was something that was revolutionary for me. It was something that helped me realize that it wasn't my fault, and it wasn't something that I needed to manage on my own. So I had bariatric surgery and largely did pretty well until I went to graduate school. I don't recommend starting a PhD during a global pandemic. That wasn't the most fun thing I've ever done. But with that, a lot of my priorities shifted. And so I wasn't able to focus on my weight management journey as much and experience some weight regain. After my wedding, I decided that that is something that I wanted to tackle. So I tried to reestablish care. And since then, I've had a variety of challenges in accessing care. My insurance does not cover any kind of weight management treatment. So everything that I do is out of pocket. And so the providers that I've had since then, some have been more knowledgeable than others, but largely had good experiences and started a GLP-1 medication in the past year or so. So I've had a wide variety of experiences with the weight management spectrum and the different types of providers. I've had weight bias providers, I've had better providers, so experienced it all.
Thank you, Faith. Nikki, would you like to go next?
Sure. So my experience reads a lot like Faith's, except I'm older than she is. I have lived with obesity my entire life. I always tell people that I was a big baby, a big kid, a big teenager who grew into a large body woman. And around the time I turned 31, 32, I decided to have bariatric surgery. This was after I had already had two children. Coming up as a person of size, my mom was very concerned about it. However, I grew up during the 80s, which was the height of diet culture. There was always some new diet to try. I was put on many of them. I don't remember having a lot of interaction with the medical community as a child with regards to my weight. I remember it being mostly sort of interventions at home and my family trying to encourage me to eat less and move more and things like that. And they were well intentioned. I appreciate what they were trying to do, but it really did sort of um for lack of a better term, otherize me within my household from people who in my household who were closer to what they considered a normal weight. So by the time I was 31, 32, I have two children. I decided to get bariatric surgery mainly because, I had these two small children and I wanted to be able to keep up with them. And I was having a really, really hard time with that. So I underwent Roux-en-Y gastric bypass surgery, and that was pretty effective initially. I lost a total of 155 pounds there. The transition into a post-bariatric lifestyle was particularly challenging for me. Um, One of the things that I wanted to make sure to highlight today is that not every bariatric patient and not every person struggling with obesity identifies with or should identify as a food addict. However, that was like sort of one of the very, very surprising revelations for me afterwards was that I do have, I identify as a food addict. And so I had a lot of mental health struggles in the first couple of years, being able to jive in my head. The thoughts that I had about food versus my ability to eat food. But still, I worked through those. I worked with mental health professionals and, my bariatric team, and I had support groups, and that was great. And I feel like, yeah, Faith, my trajectory is similar. It's like everything was great until in 2016, I got breast cancer and I ended up having to have a bilateral mastectomy. And up to that point, I'd had a small amount of regain, but my weight had pretty much stabilized. From there, just for a variety of reasons, stress, life changes, whatever you want to call it. I started gaining weight really, really rapidly, and then going into the pandemic even more so. So as I sit here, I do have a significant amount of weight regain. My job-sponsored insurance does not cover, it does cover things like surgery, but it doesn't cover things like the medications. So I am just sort of I had to sort of get my bearings and getting back into reestablishing care. One of the challenges in that is that, the bariatric surgeon I saw doesn't really deal so much with long-term patients. And so like finding a bariatrician and somebody who, knew how to even sort of approach me as a person who had bariatric surgery, but now has had weight regain and needs or wants to address that. And so, I'm just sort of at the beginning of that journey now, but that's sort of where I am in a little bit about my history.
Thank you, Nikki. And Vu, would you like to take us home from here?
Sure. So I've lived with obesity my entire life ever since I was little, and I think one of the things that I found interesting is that a good portion of it I didn't realize I was living with obesity. So growing up, there's always this conflicting feedback I would get from folks, and whether it was some family members would say, oh, you're getting bigger, you should do something about your weight. Oh, and there would be comparisons to other family members who are larger and their health issues, and then for other family members or others within my culture, they would see it as a sign of prosperity. Say, oh, you're doing very well. Your family must be succeeding where they've struggled in the past for you to be able to live in excess, right? To have extra weight. Even in some of our iconography, if the idols had excess weight on them, it was to show that they were taken care of and they're joyful and they were living in abundance, and these were good qualities. So there were times where it would be confusing to sit with two different family members, and one that would say, "Oh, keep eating, eat, like, this is for you. This is we want you to enjoy this," and then others would be, you probably could stand to lose a little bit of weight. And the language that was used then probably wasn't as PC as it is today. So I would bounce back and forth. So mentally, it was very confusing to understand. Like, am I struggling with my weight? Is this a good thing? Is this a bad thing? But getting into schools and meeting with Western culture and friends, there that became a little bit more apparent that being, as a kid, anyways, being overweight was not a fun thing initially, because they would poke fun as kids, honestly, brutally honest. They could say some pretty hurtful things. But then I would also realize, like whether through media, whether through like watching interactions with other folks living with obesity, that there was this odd stereotype where they expected that if you had excess weight, that you were supposed to be funnier. And I really leaned into that because I saw that if I was funny and I cracked the jokes first, then nobody else could make that joke about me. And so I kind of developed an odd coping mechanism, defensive mechanism of cracking these jokes or doing a lot of self shaming, self detrimental humor there that I didn't realize I was doing until much later on. But then even my approach to weight changed even further when I was out of my parents' household, when I was on my own and eating what I wanted to eat and doing what I wanted to do. And in college, it was odd to see that weight was not. It was never a negative amongst guys. Like among my peer group, it was like, oh, guys are just huskier. Like, oh, a little bit extra weight is a good thing. Oh, people like a little bit of pudge. And there was no longer at that point a conflicting voice that was saying, hey, you should watch your weight a little bit more. I didn't have my parents there to guide me. All I had were folks were in the culture. It was like, hey, like you're fine. This is perfectly okay. And they would point to like the TV shows we watch, the movies we watch, the dad or the guys were always a little bit were even in the cartoons they were drawn curvier than the moms and the sisters in the cartoons. Almost every animated feature we saw fit into that. And so when I did start having health issues, when I did start visiting with medical professionals, it was very jarring for them to immediately point to my weight. And at the time, it felt like, well, that maybe that should be a little bit more obvious, and I wasn't seeing it. But I visited multiple providers because some of the providers that I met, the way that they approached my excess weight was so off-putting. I was not comfortable working with them. So I appreciate the opportunity to be on this panel because I'm looking forward to talking about how important it is to have that the special relationship with your healthcare practitioner. Because I lucked out by eventually finding somebody that I could trust who treated me with dignity, and we approached my health together in a way that I felt good about what I was doing instead of just feeling this feeling of shame. I know not everybody out there is that lucky, so I'm hoping that today we can help change that.
Thanks, Vu, and thanks all of you. I thought that was really awesome, and I think will be really helpful for a lot of the audience of the forum. One of the things that really jumps out to me from what each of you were saying there is, there's this perception that obesity is sort of monolithic, and the obesity path is sort of linear, and couldn't be more different in how you each talk about it. You each have very, very different paths. You each navigated different things. You each had challenges with different things. And from the long-term management of the obesity, it was never, I think, linear. There were ups and downs and sort of circuitous paths. And as life got in the way, that can make it more challenging. You fall back a bit, but you kept moving forward. And each of you ultimately got to a place where I think you're healthier and feeling better, but certainly not in any linear way. Um, One of the things that you each started to touch on is the experience of living with obesity with respect to the biases that tend to happen, with respect to the weight stigma that is unfortunately very common. Let's focus on this a little bit, particularly with respect to weight stigma in medical care. Your experiences in working with clinicians, whether the clinicians that you were going to explicitly to work on weight management, or other clinicians, whether primary care doctors or otherwise. Um, I wonder if you have some things you can share, both positive in terms of really positive, supportive environments that you were in, and supportive interactions that you've had with clinicians, and also some of the not so positive things where you may have felt judged or misunderstood, and how that impacted your life, your weight management path, and perhaps even your health. And so, Faith, can we start with you again?
Yeah, so my experiences with reestablishing care gave me a good experience and a bad experience. So, when I was first reestablishing care, I found some loophole through my insurance that if I went to this specific clinic, it would be covered under this thing, which was not obesity related, but it was a weight management clinic. So I decided to give it a try. And I went for a couple of appointments and they were fine. But I think we talk a lot about very explicit bias, like when I was younger and told not to eat cookies for dinner. But what frustrates me more than that is when well-intentioned providers are unintentionally biased. So in this appointment, she had gone through with me a full day of my eating. And as I mentioned, I'm a bariatric patient, so my portions are a little bit different. But she asked me roughly how many calories I thought that I consumed a day. And I gave her a number and she said, "Oh, there's no way. There's no way you wouldn't be gaining weight if that's how you were eating." So I went the following week and I tracked every single day how much I was eating. Nikki's nodding. I tracked every single day what I was eating, and it came to the number that I had told her. And so I went back and I presented that kind of information, and we were able to move forward, but it damaged that relationship in that I had lived my entire life tracking things. I know how much calories are in what I eat. I have a pretty good basis of how much that I'm eating in a day, and for her to question it after so many years of tracking and those types of things was really frustrating. So I ultimately decided to move on from that provider and went to a telehealth platform. And what I was concerned about is that they would make me start from, step one and work on my dietary and physical activity behaviors, which I had felt like I was in a really good routine with my diet and physical activity. So I was interested in medications. And so I was actually relieved because after that appointment, I left with a prescription in hand. They listened to my concerns and they didn't make me start with what I was seeing as step one. They recognized that I had a complex case, that this is not my first rodeo. I had had bariatric surgery and I needed this additional intervention, and really listened to what I had asked for. So I would say that's the thing that concerns me most is when you go to providers. That was a weight management clinic. I thought that I was talking to someone who would meet me with understanding and empathy. And I don't even know if she recognized the harm and the bias in the statement that she made, but I really remember that damaging and, changed the way that I looked at that clinic and that provider. So that is what I really challenge providers to think about is even when you're well intentioned, is there anything that you think in an appointment or you say in an appointment that could lead that patient to think, are they believing what I'm saying? Because there are a lot of times in these appointments when we're not believed. I remember when I was younger, my provider always thought you're lying about what you're eating. You're lying about what you're eating. And that led to my mom questioning, are you sneaking food? Are you doing this? And there's a lot of mistrust that builds. And you want to have a collaborative relationship with your provider. So I want everyone to think about those things that, maybe seem well intentioned, but can lead to that mistrust that can really eat away at a relationship.
Thank you, Faith. Nikki?
So I was not in my head because, yes, some similar experiences there, but I think I want to talk about sort of the trajectory of my relationship with my bariatric practice. Because when I first went to them in 2008, there was, this sort of plan laid out ahead of me. It was pretty standard. The participants in this forum will probably recognize it from the period of time of, where you go in and you see the surgeon and you have to see, get a psychological evaluation. You have to be evaluated by a nutritionist, and they all have to agree that you have what it takes to make it after surgery. And for some length of time, you have to go on a diet to lose weight and all of that good stuff. And it's interesting because my mentality then, as a person who, was going into my treatment phase, all of this seemed perfectly reasonable. It seemed perfectly reasonable that I should have to prove my worth to have this surgery by jumping through all of these hoops and doing all of these things. And even afterwards, I was a rules follower. I followed every rule to the letter. However many calories they told me to eat, that's what I ate. However much I was supposed to exercise, that was how much I was supposed to exercise. However much protein I was supposed to get, that's what I was getting. Um, but then something changed. As I said before, I had an uptick in my weight even before my breast cancer diagnosis that happened very much during the time where I was still a very avid rules follower. And so I freaked out and I sought help from my bariatric surgeon's office. And by this time, I was a couple of years out. They're not really accustomed to seeing people as far. I still came in every year, but it was very much like sort of this smile, we'll see you. But they didn't really have like sort of a program for somebody who was as far out as I was. And so, I came in, I reported it, and there was this assumption that I was doing something quote unquote wrong, or that I wasn't supposed to be doing. I was eating something I wasn't supposed to be eating, or I wasn't exercising as much. And I really and truly, I was documenting everything and I was following the rules. So that sort of pulled me back from the bariatric practice. And I didn't go for a number of years. And then when I had made one other attempt post breast cancer diagnosis to sort of reestablish contact because that's what I knew. I didn't know where to go because my primary care physician very much he's sometimes downright flummoxed by how my body works. It's like I didn't know where to go but to my bariatric surgeon to address this, and so I went back to him after I gained a considerable amount more weight, and the answer to that seemed to be to sort of treat me like a pre-op. And so he gave me like sort of what is effectively a pre-op diet that put me on like something like 900 calories a day and, moving a certain amount of time and everything. And in my head, I'm looking at this piece of paper and I'm saying, okay, this is, I don't think this is going to work, but I will give it a go. But there wasn't really okay, here's what happens if this doesn't work out or whatever. It was just like sort of, these are sort of the steps in becoming a post-op. And then if you struggle, we just go back to square one, as opposed to like sort of talking to me like, what's going on in your life? What's changed in your life? What's changed about your medical situation? What can we look at to figure out how we can help you here? It felt sort of formulaic, and I don't put that on the personality of my surgeon. My surgeon was great. He was very supportive during the time that we had our most active period of care, but it was just seemed like nobody in my medical team knew what to do with me once I was more than like 4 or 5 years post-op, and that was a little bit frustrating to me, and it came off sort of as biased to me in the sense that, like you said, sort of the linear sort of progression of obesity, that, you have surgery and you're not supposed to have problems anymore. Well, I have problems and I need help with them. And what do we do when you have a problem after somebody has had surgery? Because surgery was not the end of the road for me.
Thank you, Nikki. Vu, what would you like to add?
I visited quite a few doctors at this point, and I have this funny metaphor analogy, or I sometimes feels like when I go to meet these new physicians or these physicians for the first time, it feels like I'm going on a first date or a blind date because I don't know anything about them other than what's on their website. But then you sit down with them and then you have this conversation, and you can almost tell in the first few minutes, oh, how's this date gonna go? Right. And so the office visit, a lot of times, if I would sit down, and then if they kind of, it's always like, oh, so why are you here? We talk about my excess weight. And if they started that conversation and asked me about like specific numbers, like almost like they're trying to fill out a formula, I could tell that this was not going to go as well as the ones where when I met with them and they asked me about my life experiences and what was my journey like in high school, or what life changes have I had since graduation and so forth. The ones that stopped and took time to know me beyond just what was in the chart, I had a better relationship with, and I felt heard, I felt understood and supported by them, and I felt less like a chart and more like a patient. And that helped me because a lot of times if you go to somebody with a problem, you're revealing a vulnerability, right? So going to the doctor sometimes felt like I'm standing there naked, sharing them with, and sometimes literally, right? If you go to a doctor, I'm sharing vulnerability, and I'm asking for the guidance because I recognize that they have had training, they've had education, they have experience that might be able to help me. But I do want to share that one of the greatest experiences, one of the good moments I truly felt heard with a provider, um, I came near to just being so frustrated that I could not understand obesity. And like I researched and I read and I question, and I still couldn't figure out why my body was doing what it was doing. And so I told the provider, and that's why I'm here, hoping that to get some answers. And he caught me off guard by telling me, and what I saw is like a moment of humbleness or humility, that obesity is complicated, and even he doesn't have the answer. He said even the medical community doesn't have the answers. We're still learning. We're still figuring this out. So he said it's foolish to expect to hold yourself to that standard where you feel like you have to understand and completely know it. We're going to learn this together. We're going to go through this together. And it was that at that moment, I really felt like I had a partner in this journey. And it was one of the greatest things a provider could tell me, and let me kind of almost like absolve me of that pressure of feeling I had failed myself, and instead hear that no, that's okay. We're going to learn this. This is complicated.
Thank you, Vu. This is just so helpful. There's no question this is going to be incredibly valuable for all the audience that's watching this. And on that note, with the last few minutes we have left, I wonder if we could turn our attention to giving some advice, if you will, for the clinicians that will be watching this panel, in particular regarding shared decision making in obesity care. You each sort of touched on that a little bit in terms of your experiences, but I'd love if you could touch on how experiencing an interaction with a healthcare provider in which shared decision making was used rather than sort of a paternalistic finger wagging kind of approach, how that helped you in your path, whether in the near term, in doing the sorts of things that you might have agreed on with that doctor, or perhaps even beyond that in the long term. And if you didn't have those experiences, what is it that you might offer to the clinicians that are watching that can help them in their interactions with future patients? And again, Faith, would you like to start?
It's interesting because I don't know that I've ever had a shared decision-making situation. For every time that I've accessed care, I went into it with the care that I wanted, and I learned about that care from either online or people in my life. And I work in research and I work with other kids who have had bariatric surgery. And we know from qualitative research that they are also coming to making that decision by hearing about surgery from family members or friends and then going to talk to a provider about it. So we're missing out, I think, on that key counseling of treatment options and coming to those decisions together. I think about GLP-1s and how people are getting a lot of information online and then going to their providers. It's something that they've decided before they walk in, and it's something that they want. So, in terms of shared decision making, I think we have to acknowledge that weight is something that there's a variety of information online about whether that information is good or not. A lot of patients are coming in with predetermined ideas of what they want. So listen and guide them when they've been misinformed by that information, but really acknowledge that they have put a lot of thought into it prior to coming to you. And I think that comes from bias where they haven't been believed in the past, or they've been expected to know things about themselves and them and their health, like Vu mentioned. He expected himself to be an expert on obesity. I think a lot of patients have that expectation for themselves. So acknowledge that they're getting information from a variety of different sources, and you can really be a source of good, truthful information on that journey.
Thank you so much, Faith. That's super helpful. Nikki?
So, three quick things. One is that I think that even though weight has to do with health, it also has to do a lot with a lot of other things, how we think about ourselves, our self-image, our sense of self-worth. So the first thing I would say is sort of have permission to sort of enter into that conversation with your patients. And even if you're an obesity provider, you don't know what that person is walking into. So if you're going to have a substantive conversation, maybe start it by saying, "Hey, here's the things I'd like to talk to. Are you in a place where we can talk about these things today?" That's first. Second is I always draw parallels between how my cancer was treated and how my obesity was treated. My cancer was treated in a way where there were various treatment options I could have made, and people spent time explaining those treatment options and what the possible side effects, implications, challenges would be for those things, and helped me then sort of step back and said, okay, this is ultimately your decision, but we want you to know what all of these things mean. That kind of conversation never happened on the obesity side for me. Even if I came in with a predefined idea, I didn't know what other options that I had, and nobody sat down to explain it. So if we could take a beat to talk about, okay, what are my options? What are the different roads I can go down? And what, are some of the things that I should keep in mind as I'm thinking about it? And then lastly is like sort of just making agreements with a person, and not just like telling somebody what they're going to do, but okay, what is it from here that you would like to do, and let's set a deadline or set a date or set a follow-up to do that. I think that in the times that that has happened, and again that's happened more so on the cancer side than it has on the obesity side, I felt like somebody cared enough to come back to the conversation. It's like, okay, I don't have to make all the life decisions right now, but this is where we're going to come back to it, and I have some time to think about it. So really for me it's mostly about being mentally prepared to have a conversation and follow through with it.
Thank you so much, Nikki. Vu?
Yeah. So speaking of shared decision making, I will say there are times where my brain is so fried that I just want somebody to hand me a plan and I'll follow it. And that doesn't always work out well for me. It might, in that moment, I'll get that task done. But thinking of a personal experience, uh, I was assigned a dietary plan, and it was just given to me, and I followed it, and it worked for a while, and then until it didn't, right? And I didn't have that buy-in to continue it. But I had a dietitian who sat with me and explained what we were trying to reach. And we worked together on coming up with a plan. She challenged me and asked me, well, how do I reach this? What can I eat, or what can I do to reach this? How will I accomplish this? And it took longer to come up with a plan, a little bit on maybe some of my stubborn headedness. But what we came up with, every time I followed, I remembered this was my plan too. I helped come up with this, and I didn't have to question why this, why that, because she talked me through it. And so that shared plan helped me feel more buy-in, more agency in that plan, and so it helped me stick to it. So I'm a big fan of shared decision making, because the other part of that too is that shows that the other party respects me enough to believe I can be a part of that decision making. I come in with the understanding that they are the professional, they are the specialist in this, but I have done some research. I didn't come to them empty-handed. I did try things first, so that they respect me enough to uh, help me, allow me to include that. That makes me feel good. And I think that ties into what would be my final point, is that my best relationships with my clinicians and my providers um, always include kindness and dignity. I think our community, dealing with excess weight, we dealt with a lot of hate, a lot of terrible moments, a lot of moments of kindness throughout entire lives, a lot of words that are downright mean, and not the least of which come from directly within, that we battle with. And so when we meet somebody who treats us with kindness and allows us to understand that it's not our fault and that we can be part of the solution, um, it gives us the dignity to move into that relationship with a lot of comfort. Sometimes we will follow people out of shame, because we're so shamed that we feel guilty and we have to follow them, but we'll follow them until we can escape, until we have that first moment we can get out of here, because we don't like feeling shame. We don't feeling that guilt. But somebody that makes me feel like I did a good job, somebody who gives me the tools to feel like I am able to use what I have to be a part of my own solution, I'm going to stay on with them on my journey a long, long time.
Yeah. Thank you so much. All of you are so insightful and articulate, and I think this is going to be incredibly valuable for all the attendees. So thank you all for being a part of the panel. I want to thank the people that put the Obesity Forum together as well, in particular for including the voice of the patient on the panel. And I think it says a lot, additionally, that it's put first and center, that we're starting the entire forum with this panel. Of all the things that we could dive right into, whether the pathophysiology of obesity or treatments or whatever, we started here because this is what matters most. This is at the centerpiece is the people that we're all trying to work with and help as clinicians. So thanks everyone, and thank you everyone that's watching. Bye everyone.